We are at Florida Orthopedic Institute in Brandon. Roxanne Wilder with you, and I'm so happy to be joined today by two wonderful doctors, Dr. Neil Kumar, as well as Dr. Jeff Selman. Great to see you both.
You too. Thanks for having us.
Of course. I'm going to start with you, Dr. Selman, because you are a orthopedic, of course, you're in that realm, sports medicine, primary care physician. I would love to hear about this sort of whole patient approach that you look at and that you sort of embody here.
Absolutely, and that actually stems from my specialty. So what a primary care sports medicine doctor is trained in first is a primary care specialty. So in my case, it's family medicine. So you take all those rules that apply to a family medicine patient and apply them to an athlete, but maybe a little bit different because they are a little bit different. And then we also incorporate the orthopedic injuries themselves. So we just take the metabolic, we take the hormonal, we take even the psychological, the nutrition part, and just look to see if there's something that we can adjust, we can address to make people either healthier or prevent injury.
Oh, wow. I could talk with you endlessly about this because it is so cool with the whole patient approach going in all those different directions. And I would love to hear more, of course, from you, Dr. Kumar, in terms of the revolutionary technologies that we're seeing and the advancements in this entire field.
Well, we know that unfortunately some people do get hurt, and from the standpoint of orthopedic surgery, sometimes that does lead to injury and surgery. And so in order to try to get our athletes and our active patients back to the sports they love, we really incorporate new technology now to make sure that the patients really understand where they are in their recovery plan, right? So be able to use, force plate, use neuromuscular stimulating devices with apps to give patients feedback so that they can track their own progress and make sure that they're working together with our physical therapy team, really understand when they get back to the sport that they love, they're doing at a 100% and trying to cut down the chances of another injury. They really feel like that accelerates their rehab.
Have you really seen lots of changes over the years where you have someone get injured and they're able to come back much quicker, or they get surgery and they're able to come back much quicker?
Absolutely. That's a combination of what we do in surgery, using new technologies to make surgeries faster, less invasive, less traumatic, and then after surgery with the recovery, making that recovery process more streamlined, more efficient, and that just gets patients back in the game faster and better.
And Dr. Selman, I also want to find out, just when you're looking at ways that patients can improve how they take care of themselves in general, how do you help them in that way?
So first, looking to see what their lifestyle is really like, because being at home is much different than being in a doctor's office. And so it's really important to even have their family tell what they do at home and where they go about eating and that kind of thing, because they don't always say the exact things when they're in the doctor's office, which is perfectly fine.
Right.
But then we have blood work to reveal what they're actually doing or what they may not be doing, or what is actually revealed that we don't know what's going on that can absolutely have a positive effect on the healing process when Dr. Kumar cuts on them.
It is really interesting, like the blood work can really show a clear picture of what's going on that's going to then help the metabolic health and help the, whether you're muscle building or whatever kind of athlete, however active your lifestyle is. What can patients do? How do you help them in terms of preventative care?
So we address, of course, their diet and see if there's something that is inflammatory in nature, or that's something that could be leading to their deficits that could be leading to an injury. It's very important beforehand to make sure that you do get nutritional labs, because there are labs that we get for an athlete that we don't normally get for the regular population. It's similar to an EKG that reads the heart. We allow things to change in an athletic heart that is not for a typical population. So similar blood work, for instance, iron, not just iron, we look at a marker of iron storage, and we make people feel so much better, and they have more of that oxygen carrying capacity to heal better.
Oh, that is fascinating. Well, thank you guys for talking with us today.
Absolutely.
I love this field of medicine. I always learn so much when I talk with you all from Florida Orthopedic Institute, and you can learn more when you visit the website. Thank you, gentlemen, for joining us today.
Thanks for having us.